To get the most out of your exercise while staying safe, it is important to monitor your exercise intensity. This can be done two ways. The first is to self-monitor your heart rate. The second is to monitor how hard you feel you are working during exercise, which is called your rate of perceived exertion. For this video, we'll focus on how to monitor your heart rate. We'll explain how to monitor your rate of perceived exertion in another video. Your cardiac rehab trainer will give you a target heart rate zone based on the results from your exercise stress test. This zone is a prescribed range of how fast your heart should be beating during aerobic exercises like walking, cycling, or swimming. Staying in your target heart rate zone during exercise can help condition your heart, while not overloading it. How to measure your heart rate during aerobic exercise. There are 3 different ways you can measure your heart rate. 1. From your wrist. 2. From your neck. 3. With a digital device. How to monitor your heart rate using your wrist. Place 2 or 3 fingers on your right or left wrist below the base of your thumb. Count the number of beats you feel in 10 seconds. Then, multiply that number by 6 to get the number of beats per minute. How to monitor your heart rate using your neck. Place 2 or 3 fingers on the right or left side of your neck in the hollow area beside your windpipe. Be gentle to avoid feeling lightheaded. Count the number of beats you feel in 10 seconds and multiply by 6 to get the number of beats per minute. How to monitor your heart rate using a digital device. There are many devices that can measure your heart rate and show beats per minute on the screen. Some examples are pulse oximeters, wearable fitness trackers, smartphone apps. When should you measure your heart rate? We recommend that you measure your heart rate at the following times. Before you warm up. During exercise as often as needed to stay within your prescribed zone. At the end of exercise, just before you cool down. Note, do not try to measure your heart rate from your neck or wrist while you are moving. What can your heart rate tell you? Tracking your heart rate tells you whether you are in your prescribed training zone. This is important for building your fitness, while keeping you safe. For example, is your heart rate above your target zone? Slowing down or doing less can bring your heart rate back down into the prescribed zone and make it easier on your heart. Is your heart rate below your target zone, or does the exercise feel easy? Speeding up or doing more can raise your heart rate into the target zone and improve your fitness. In summary, to get the most out of your exercise while staying safe, we recommend that you check your heart rate using your wrist, neck, or digital device. Keep your heart rate within your target zone. You can measure your heart rate at any time, not just during exercise. Try it after watching this video while sitting down. Then, try it in your next exercise session. You can also talk to your cardiac rehab trainer about how to build heart rate monitoring into your exercise program.